Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. These days, it's rare that you will escape having to go under the knife at least once in your lifetime. If you haven't, consider yourself blessed. For the majority of others who aren't so fortunate, though, it can be pretty scary and unnerving to think about having to go through surgery. It's estimated that more than 50 million Americans undergo some type of surgery every year. Express Care's Dr. Jitka Lom joins me in studio tonight to help give us some tips on how to prepare for surgery. So, have you ever had to undergo the knife?
I have had several.
All right,
yes.
So you know firsthand.
I do.
So let's talk about what are some questions that somebody should ask before they hear surgery from their doctor, and it can be scary.
Very scary. I think the thing to do is to make sure that they understand fully the purpose of the operation and whether there are any alternatives. Sometimes there really isn't an alternative, but other times there are. And so it would be important for you as a patient to feel completely comfortable that this is the right path for you. So there are many questions to ask. What is the expected outcome if everything goes really well? What is a complication that could occur? What is the disability that might occur after my surgery? How long will I be out of work? What kind of pain can I expect? These are all lots and lots of questions that you can think of. So you can think of like the preparation. You ask your surgeon, how should I prepare for my operation? What can I expect during the operation? And what can I expect for my recovery? And another important thing to ask would be where the surgery can be done, whether it should be something that's done here on Guam in the hospital, or if it's done in a surgery center, in an office, or if it should be done off island.
Okay. And so one of the things I was reading up there are different types of surgery, elective and emergency. Can you explain that?
Sure. So some surgeries are emergencies. They have to be done right then, otherwise there will be loss of life or limb, meaning you're going to either die or lose part of your body that you need. That's an emergency. An example would be a car crash. You have a severe broken arm or broken leg that needs to be fixed in the operating room so that it can heal properly and so that your bleeding can be stopped. That would be an emergency. You don't really have a choice. As far as urgent surgeries, those are ones that you have a little bit of time to think over, but they still must be done. An example would be you have a tumor of some kind growing that's a cancer, and eventually that needs to come out. It should be done sooner rather than later. Mm-hmm. Elective surgery is one where you have plenty of time to prepare, at least a week or two or longer. And this would be an example of that would be your gallbladder's been bothering you. You've been having pain in the right side of your abdomen off and on, and burping and bloating, and you've had an ultrasound and they found gallstones, and now you're going to have that gallbladder removed. But you can decide when you're going to do it, where you're going to do it. There's no emergency there. Of course, that's the best, nicest surgery to have, where you have plenty of time to decide and you have time to prepare.
Prepare and plan for sure.
Yeah.
Now, how important is it for someone to sit down with their doctor and really talk about?
It's incredibly important. Now, you can do a lot of research on the internet in advance. You can also talk to other people maybe who have already had that type of surgery, although stay away from the ones who tell you nightmare catastrophe stories. Only talk to the ones that had good outcomes. But you should do your own research, but then take the time to speak to your surgeon about, again, what are the things that they expect and what are possible things that you should anticipate as far as if there are any complications. And that will help you feel a lot more comfortable about your upcoming operation.
Now, are there any foods or medications that you should avoid before surgery? And I mean, maybe it would differ for different surgeries.
It might. In general, people should be taking their regular medication, let's say for their blood pressure or diabetes, including up to the day of their surgery. But there are some medicines that you should stop a couple of weeks before, and that includes aspirin, usually Motrin, some supplements such as fish oil and ginkgo biloba, because these make you bleed more. And so you should stop those a while before your surgery.
Okay. Now, statistics show that most of the surgeries that are performed are done on women. Are there any additional precautions that women should take before undergoing the knife?
Yes. If possible, try not to schedule your surgery during your period. That's going to be very unpleasant and make your recovery harder. Also, if women are older and, for example, with breast cancer, there's some evidence that having the surgery in a certain time of the month may give you a better outcome. So you should talk to your surgeon about that, in particular with breast cancer.
Interesting.
Yeah.
I haven't heard of that. Is there any way to prepare emotionally and physically for surgery?
Yes, definitely. That's just as important as preparing your body. As far as physically, definitely quit smoking before your operation. Don't drink more because you're anxious. Let's live a very healthy lifestyle as far as getting lots of rest, getting some exercise, and eating right as much as you can prior to your operation. As far as mentally, you must prepare as well. It's super important to have a positive visualization of how your surgery is going to go. Don't just think of like, oh, they're going to wheel me into the operating room. Think of yourself being wheeled out in great shape, doing super well, and then having a very nice and smooth recovery. And you can actually do this online, or you can buy relaxation tapes or preparation tapes on Amazon. But you can go to a website called prepareforyoursurgery.org, and it has excellent visualization resources there. It has all kinds of checklists and all kinds of things that you can use to your advantage.
Okay, prepareforyoursurgery.org.
Org.
Thanks for the advice. We will pick up our discussion on preparing for surgery when Healthy Living returns.